PCOS in a minute. PCOS refers to that group of women wherein they have a syndrome manifested by amenorrhea, hirsutism, obesity and associated with enlarged polycystic ovaries. Okay. We use something called as a Rotterdam criteria for the diagnosis, which state that any two of the three following criteria, if seen in a lady, we can label her as a PCOS patient. So, the three criteria are 1. Oligo or anovulation, hyperandrogenism, which can be either clinically evident or a biochemical evidence of hyperandrogenism, and 3. Ultrasound findings of polycystic ovaries. The pathogenesis of PCOS can be in simple terms understood this way. This group of patients are seen to have an insulin resistance, and this is causing subsequent hyperinsulinemia. They are also seen to have a hypersecretion of the LH hormone, that is the luteinizing hormone, and a state of hyperandrogenesis is caused in these patients as a result of the insulin resistance and the hypersecretion of the LH hormone. So, these are the three important underlying pathogenesis which occurs in this group of PCOS ladies, and as a result of these following biochemical changes are noted in the ladies. 1. This is important for you to learn and understand. So, there is an increased LH is to FSH ratio as a result of your hypersecretion of the LH hormone, right? And there will be presence of high estrogens again as a result of your high LH hormones. There will be increased free testosterone and DHEAS and low sex hormone binding globulins as a result of your high androgenesis and increase in the sex steroid production. And there will be abnormal glucose tolerance test and elevated fasting blood sugars and a presence of abnormal lipid profile owing to the insulin resistance and the hyperinsulinemic state. So, these group of patients, these group of PCOS ladies clinically present with menstrual disorders ranging from amenorrhea to oligomenorrhea to irregular cycles and to heavy bleeding. They also have all the features of hyperandrogenism such as hirsutism, acne, seborrhea. They will be obesity patients. They can have, some patients will have the presence of acanthosis nigricans, which is a presence of velvety patches over the nape of the neck and in the axilla. This is again a sign for insulin resistance. And due to the menstrual irregularities and the chronic anovulation, these patients also suffer from infertility. When you have a patient with PCOS, the management of a PCOS patient is mainly in terms of treatment of the presenting complaint and prevention of the long-term sequelae. What is this long-term sequelae? They can suffer from metabolic syndrome in their later future life because of the occurrence of the insulin resistance, right? This insulin resistance can give rise to diabetes mellitus, hypertension, dyslipidemia and risk for cardiovascular diseases in the future. So, a patient with a PCOS lady, the management is quite simple in terms of the presenting complaints, right? Like when you have a patient with menstrual irregularities, you control it with the use of OCPs. When you have a patient with dermatological lesions, you treat her with the appropriate dermatological interventions for her acne, hirsutism and seborrhea. As such, there is nothing called as a complete cure for the sake of PCOS because it is mainly said to be a lifestyle disorder. So, hence, lifestyle and dietary modifications form a very prudent and important part in the management of PCOS patients. Okay. So, the management involves the treatment of the presenting complaints and prevention of long-term sequelae. That is, you advise them about their lifestyle, about the food intake, about the occurrence of diabetes mellitus in the future and the appropriate modifications to be done in the lifestyle and the diet, and counsel them regarding that. Patients who are suffering from infertility due to PCOS should be offered infertility treatment in such couples. This is a brief capsule on PCOS. I hope I made it easy for you to understand. Thank you.
do.